Okay, I would like to welcome everyone to the Littleton Board of Health meeting. It is April 1st, and obviously this is a Zoom meeting. And I just want people that are joining the meeting, set your microphones so that you are muted and so that the meeting can occur in an orderly fashion. We ask that people who join keep their microphones on mute so background noises do not interfere with the meeting. Should any member of the public wish to speak, please state your name and address because normally we have a sign-in sheet and obviously we can't do that on Zoom. So state your name and address, and we ask that you use the chat box to let staff know that you would like to be recognized, and then staff will monitor the chat box and inform me, the chair, of individuals that wish to speak. Upon speaking, we request the microphone be placed back on mute. Okay, so we're going to open this meeting, and the first order is a nomination to the Littleton Volunteer Corps, and her name is Christine Nordhaus of 43 Star Hill. Would anybody, and this nomination is contingent upon her completion of a query. Would someone like to make a motion?
I'll move that we nominate Ms. Nordhaus to the requested position.
Any second?
Second.
Okay, so now we'll do the roll call. Is Gino on? Okay. Kevin?
Yes.
Lisa? Lisa?
Sorry, yes, aye.
Mike?
Yes.
And I say aye also.
All right.
Okay, so Christine Nordhaus is all set to join the Littleton Volunteer Corps. And our next on the agenda would be to get an update from either Jim Gareffi or Scott Wodzinski, if either one of them is on yet.
So this is Jim Gareffi.
Hey, Jim.
So again, we're still fielding calls for all variety of businesses in town. As cases come in, positive cases come in, we're letting the fire chief know so that he can update the dispatch list, make sure that they know of where the cases are so they can have their EMTs properly prepared. We are dealing with a little bit of a situation at the nursing home. It's kind of evolving at this point. I don't believe that it in any way endangers the citizens of Littleton, but we've reached out to some state agencies and we're waiting for some responses back.
Okay. Jim, would you like to speak? I know you went to Market Basket yesterday. Do you want to speak about that now or later? Or
I can do it now or later, however you like.
well, since you have the floor, why don't you do it now?
Okay, so I went and visited Market Basket. Again, I went unannounced, so I could see kind of what they were actually doing. What I noticed was when I first walked in the door, they had somebody at the front desk actually calling over the comm system, explaining the people's need to stay 6 feet apart, to follow the lines that they have up at the register. And they were doing it at a regular frequency, and they were mentioning that this is being requested by the health department and the state health department. So that was the first thing I noticed. They had another person right up where the registers were, and that person was trying to do line maintenance to try to make sure no one line got too clogged, and again trying to keep people apart. Talking with the managing site, they also mentioned that they're having people put the groceries on the beginning of the belt, so as far away from the cashier as possible to try to keep distances. And obviously the bagger is a good distance the other direction. When they can, what they're doing is they're going every other checkout line, but they find that when it gets really busy, that makes for big lines in the stores. So they open up all the registers to actually get people out of the store as soon as they can. And they did mention that their maintenance staff is looking into getting plexiglass so they can actually put shields up somehow in between the cashiers and the customers coming in.
And how was, you went yesterday, was it?
Yeah, I was there about 10:30 to about 11:15.
And how was the crowd?
It was, I would say it was busy. There wasn't long lines behind the register, but it was there were regular people coming and going. So
Yeah, because I was there on Saturday at noontime. Lisa and I were there to talk to them, and usually Saturdays are busy shopping day, but it wasn't a normal Saturday traffic, is what I'm trying to say.
well, that's what the managers are saying. They're ups and downs and their flows. And so in talking with the two managers, they get the message from the state and from the local health department about this need to try to distance people. The floors are all marked out. It's amazing how oblivious the people in the store are. Although the manager did say that at one point somebody come up and said, "What do you keep repeating this for?" And the manager explained to them why it is they keep repeating the message in the supermarket. So I think they get the message about distancing, and I think they're trying to do the things that they can do to keep people apart. They've also said that a bunch of kids aren't coming in, so they're calling in. Their parents don't want them there, and they're fine with that. They get people's sensitivity to doing that, so they're working with people as they can.
Okay. So before we go to the questions that Mike has submitted, maybe we should get an update. Is Scott on now?
I don't see him here yet, Louise.
Oh,
He
okay.
must have gotten tied up with something, so I would move along and we can see if he steps in at some point.
Okay. So Mike was so kind enough to do some research for us, and he came up with a list of assumptions and questions. And Jim, do you want to field those?
I mean, I can kind of go through with what my thoughts are on them. The first assumption there, I don't really know.
Jim, this is Judy from LCTV. Do you have video today or not?
Do I have what?
Video?
Oh, I just have it off.
Okay.
So looking at Mike's list there.
Excuse me, Jim. I don't think anyone knows what you're talking about. What question?
So Mike had submitted some questions and topics. And so under the first heading, which is assumptions, there was one about the spread of the virus. And I really can't speak to the spread. I mean, I look at the DPH numbers that are up on their dashboard, but I really couldn't speak to the penetration in the population. You're seeing the numbers trickle in. There's 47,000 people who were tested, 6,600 test positive. I don't know what that really means for either the state or Littleton. And then recommendations for mitigation methods. It's still, we're stressing those 6 foot, keeping people away from people kind of things. So.
Okay.
I think some of the thrust of the questions may have been lost in translation.
I think so.
Yeah, I mean,
So maybe you can explain the questions and I can try to answer.
I know you're busy, and so there's just, there's enough for here. The basic idea is this, that there have been several announcements in public places where there's supposed to be a peak coming to Massachusetts as a whole in the next 2 or 3 weeks. That is the number of people who are reporting positive. And my only concern is that and I don't know the answer to the question, what should the advice be given to the public beyond what we're doing today as we approach that peak? Because that peak doesn't mean the virus goes away or that the danger somehow or other is diminished. It just means what it means, which is the number of people with reported cases is declining. It doesn't mean it's not spreading. It doesn't mean that something else. It's just, as they used to say, this is a blunting of a curve, not a disappearance of it.
Sure. And so I'm not, in a couple of the public health meetings, conference calls I've had, they're starting to talk about this notion of a surge. So that language is starting to be used out there. And again, I don't think the message to the public is any different. I think they still need to do the things that they're doing, because that's what's going to help us kind of blunt that curve, if you will.
So what I was really asking, is there anything more in town, or is anybody in the general area doing anything or planning anything, to your knowledge, to provide greater emphasis to continue the ongoing mitigation effort?
Just to get the word out, I know the governor's having his press conferences, information's being put up on the websites. As information as I can accumulate it, I'll put it out to the town so they can actually put it up on their websites.
Okay. And in connection with this, and this is the only reason I'm asking is because I get some phone calls
Sure.
and text messages. Several towns have the policy of publishing or announcing the number of confirmed or putative cases. Other towns don't do it. I'm not sure, since we don't live in a dense area, I'm not quite sure what the significance of that could be. And what I guess I'm asking is, do we have any notion of the value of indicating how many cases are officially reported in Littleton? Does not reporting it create a problem, or not a problem of transparency? The idea is there any value to it one way or the other?
So let me tell you what the state's telling us on these calls. The state reports positive cases by county.
Yes.
And their concern is, in some small towns, if you start putting numbers up on the sites, in a small town, all of a sudden people start, whether it's social media or whatnot, it increases the risk of somebody finding out who those cases may be. So their recommendation is go by counties. Well, each town is typically in a county. So they're saying the board has these numbers. If the board wants to publish it, it's really up to the board. So I'm going to put that back to you as the board, as to whether you want numbers published on a regular basis. To the value of the numbers. What I've told everybody who has asked me this question, the only numbers we're going to have at the health department are the positive cases that come through the state surveillance system. So those are lab confirmed cases. And as soon as I give you a number, the next morning it's going to be different. So how often do you want to put that number up? And do you want to put a date on it saying, as of this date, and do it like weekly or whatever the case may be? There seems to be a desire in the communities to have that number, at least in the people I'm talking to.
Okay.
So again, I'm going to leave that to you. Do I think it's valuable from a personal protection kind of piece? If you've got 10 in town, they all could live around your house. They all could be, hopefully they're staying in their houses if that's the case. I don't know what level of protection it provides, except to let people know that there's people in your town. I guess the first announcement where there were cases in town, hopefully that reinforces that I need to do the social distancing message. I need to follow the rest of those public health messages to make sure that I'm safe.
Yeah, I guess where I was going to is not for personal use. Gee, if there's 5 people around, so I have to be more careful.
Yeah.
Right. I was more talking about what. Do you have any sense of whether it's this town or surrounding town, where the frequency of reported confirmed cases goes up to a point where it needs shall we say, a response or some sort, not some sort, but when you start seeing what we call a local, I use the term, what would be a local surge from your point of view, from a response point? In other words, what would say to you, we better start moving things to here or there? I mean, without public announcement, what would be
So again, all these test positive cases that we're getting, what happens is somebody's told that you're testing positive, you need to isolate in your home.
Yeah.
And so they all should be staying in their home. Supporting them, that what they call this wraparound service may be something that becomes an issue. And I think I had mentioned that we've engaged someone to try to help us figure out where we could get those services for somebody. So let's say you had a large number of seniors who were homebound. Is there something the Board of Health can do to help them get their prescriptions if they need it, or food to their house, or other services, because it may be the only person in the home and they won't be able to get out? I'm not sure there's something the board needs to mobilize other than maybe helping with those social services. I'm trying to think if we saw a grouping of them or something like that. I'm trying to think of why there may be a grouping of cases, but that we would take a look at those and then
Well, let's say the senior residence. Let's say.
Yep.
I mean, I'm not, doesn't have to be, I'm just, what I'm asking.
Sure. So there's been guidance sent out to the housing authorities about how to make, because we're getting some of those calls too, about how to maintain the facilities, about visitors coming in or not coming in, about packages being left. And if people have their own units, they have somewhat control of who comes and goes in their units. But if it's in a group setting, we're asking those housing authorities to make sure they're following that guidance as far as cleaning and disinfecting. And if they have common rooms, to either close them or to make sure that they're getting cleaned up.
Yeah, it's not that, okay, the response I'm looking at is not so much from I'm not putting everything on the Board of Health or even trying to do it in you. What I'm really trying to get at is, for example, in a high density urban area, it's that there are already, as it were, plans, so-called plans and response actions when, shall we say, the number of cases goes up to N, where N is a defined number.
Sure.
And what I'm really asking you is there any sense at all that approach follows for the smaller towns that together make up, a different kind of density profile, a different kind of thing? Are you getting any guidance at all on saying, okay, you're starting to do your own little peak, your own little climb? I mean,
No, I haven't, because I'm not sure somebody's tracking at the state, the state health department. They publish by county. So I haven't seen anything where they say if a town gets to having, 10% of your citizens testing positive, do this.
Okay.
I'm not sure that answers the question. I just haven't heard of.
You just answered it. The answer is nobody's doing it.
Not to my knowledge. Yes, we're not getting any direction to do that.
Yeah, there are no principles or there's no guidance coming your way that says.
So most of the response is that people are staying home and we need to support them in their home. We need to try to keep them in their home for that period of isolation. And to the same extent, those people who are close contacts, to make sure they stay home and quarantine. That's really what our job is, to make sure that we can slow the spread.
Okay. In connection, I'm sorry, the last one, in connection with the slowing of spread, which is not on any of the graphs for the questions, because at the time I put it together, there was no means to do it. But right now there are at least 3 or 4 different, quote, testing regimes out there. I think Massachusetts has access to at least, when I say Massachusetts, I mean in general, to at least 2 of them. Do you see any sign at all of the testing capability going up to the point where it's useful, it's being used beyond the point, or in addition to, shall we say, straightforward, do you have it or don't you? Is there any tracking, to your knowledge, going on yet?
So again, testing, we haven't heard word from the state changing it, but there's a testing regime out there, kind of that little grid of 8 categories in which you get tested. And if you fit into one of those, you get confer with your doctor and then get a referral to one of these sources. So I haven't seen any change in that. The state has, we're getting this feedback on this thing here. So the state has actually published a list of testing locations. And in that list, it actually lists, that you still need to get a medical referral. You have to call ahead. You can't just show up.
Louise, I have some comments from some people that are in the audience, if I can add to it.
Sure, go ahead, Janet.
Can people hear me?
My audio is very weird.
So, Christine.
I can't hear Janet.
Christine Nordhaus, can you hear me now? Christine Nordhaus is saying, my opinion is that the public has a right to know everything the Board of Health knows, preserving privacy, of course. June Montapalooza says she agrees. Kim says she agrees. Matthew Nordhaus says he agrees. The number of cases might help people understand the scope and severity of the situation. Alex McCurdy said he has the state stats available. Dan Kane says other towns are releasing stats, and he has some from Bill Ricca. Kim says, yes, my thought too, it makes the immediate risk more apparent. Alex McCurdy stated again, please be careful to look at similar demographics. That's the end of the comments right now.
What did you say, Janet? Can anybody hear me?
Yes, Janet said that was the end of the comments. Basically, to sum up, it was people are asking for, sorry, I'll start my video so people can actually see me. People are asking for if they could have the number of positives in Littleton on a time-stamped basis, because it would make them feel a little bit better about knowing what the severity is in this town, similar to what Bill Ricca was posting in their town. If I understand that correctly from the chats.
So my opinion is that I would prefer not to list them because we are such a small town, and as the cases grow, people will, could share that, oh, I know someone here that has it, and it could be a source for bullying and or some negative action. So I would not be in favor of that. So but we could take a vote, and or if we need, does anyone else have a comment to discuss the matter further?
Yeah, this is Mike. I'm sorry to intrude. I think it'd be a good idea to sort of have a real, shall we say, discussion about this, because the need to know has certain pluses to it, obviously. The other issue is how much meaning does a small number have, even if it's, shall we say, 15. It has absolutely no meaning in a town of 10,000. What matters is the rate of change.
Okay.
And if you look at all, and if I'm finished just the thought, if you look at the graphs and everything else that professionals use, you will see that the fixed number of cases provide only a gee whiz or some sort of response. It's really the rate of change which informs what's really going on. It's not the absolute numbers. You can start with 5 and go to 10, but you don't know if that really means there's a doubling going on or is just the normal progression of the disease. In this case, that would be a normal progression of the disease, because for every person who has one, there's 2.3 people, I believe, is the way this virus works, who get infected by direct contact, by contact. So you'd have to be somewhere, in my opinion, it's an opinion, you'd have to be, in order to make it have any significance to anyone, to say something's going on in Littleton, you'd have to have a real collection of numbers, probably more than 200, to make it have any meaning at all. Because we live in a very low density population-wise. We have other things going on. People are being fairly good or very good about mitigation. So I think it gets harder and harder to justify putting out what I would call small numbers, which one of the reasons why I asked Jim the question, is there a trigger for him as a health officer that says Littleton or whoever, maybe it's a region of 3 or 4 towns, better start looking at what's going on to try to change the rate at which cases are being reported.
Okay. It looks like we've got some people here that would like to comment, and it's C. Castellot is the first one.
Hi, I'm speaking on behalf of Acton Medical. So we have a practice in Acton as well as in Littleton, and we are seeing respiratory patients and providing testing. I think that publishing numbers and expecting that to be your town case count is a far cry from realistic. We are not testing broadly. Testing is not available broadly. And most people that we're seeing in the office for respiratory symptoms, we're saying you probably have it. You don't meet testing criteria, go home and self-quarantine. Even people who have exposure to confirmed cases are not being tested unless they meet certain criteria. So I don't think that the numbers, if published, give an accurate snapshot. And then additionally, you'll have someone who says, oh, we have 10 cases in town. That means we have a lot. I should be better, do better social distancing. And you'll have someone else who says 10 is nothing. I'm going to keep doing what I'm doing. So it's open to interpretation. And I don't think it gives an accurate, true number of the population disease.
Thank you. And I think the next one was Alex McCurdy.
Thank you. I really agree with the last speaker an awful lot. I don't think that the benefit is all that substantial. And we also have to bear in mind we have HIPAA things that we need to worry about, and Jim can talk more about that. It's too bad the fire chief got tied up because he could talk more about that. But the point that a lot of people are being tested, and there's still a lot of people that are not being tested that are being presumed to have it. So a number that is thrown out about what goes through the state reporting system for Littleton may or may not be accurate at all. And I just wanted to say one more thing. I had been running some numbers trying to get a scope of things, because one of the things I said before is you need to think about the demographics of Littleton, the size of Littleton, and compare it to everybody else. So if you look at the numbers in Middlesex County, they're quite high. But if you try to boil that down a little bit, and there's no real science to it, and that's not my job, and I could be way off, but it looks like towns around our size are about 22%, of what's going on to the bigger towns. So we aren't necessarily a hotbed of what's happening.
Thank you, Alex. Is there anyone else that is looking to comment? I don't see any. Janet, do you see any more?
Louise, can I just pipe in a little bit?
Yeah, absolutely.
So the person from Acton Medical, that's a good point that you brought up about the medical diagnosis. What we're going to give you for numbers, and it'll be part of the problem with the numbers, we may give you that you have 10 lab confirmed cases, but the doctors may be saying, go home, we think you have it. So that person then goes on to say to all their friends and family, yeah, the doctor told me that I had it. So all of a sudden you're going to have a perception out there that there's a lot more cases than, and they may be based on the diagnosis, than your lab numbers will represent. So that's part of the problem with the numbers. So if you do put the numbers up there, I think you need to have a disclaimer that there are some limitations to these numbers.
Is this something that people...
Still broken?
Is
Can
this
you hear
something...
me?
Is that you, Janet?
Yeah, I guess I'm having trouble.
I can hear you, Janet.
I have two more comments
Okay.
that are on the comments section.
You want to
One
ask them? Okay.
person says, we don't know if we're a hotbed or not without numbers. Another person said, the criticisms of lack of testing and personal interpretation are valid. Nevertheless, I feel that this is public information and the public has a right to know. And another person says, even the big picture numbers coming out of the federal government have the same issues, underreporting of numbers due to limits on testing. But they are still reporting what they have, and I think that Littleton owes it to the townspeople to do the same.
Okay. Thank you, everyone, for your comments. Are we ready to make a motion to make a vote on this, or is there more discussion?
I'm sorry, this is Mike. I just like to come back to a point that I think is being missed here. And I think it was illuminated by two previous comments. And that is the absolute number still has, even though it's a number to look at and respond to in some way, the real piece of information now that we're into the pandemic is the rate of change. And and if you look at the data that's being used by the feds and everyone else, including the state, what they're watching for and looking for and evaluating is the rate of change, not the total numbers themselves. The difficulty arises is a technical one. How large does the population of folks who have the disease versus the total number of people in that population, that is the whole population, when does it become significant enough to follow and to understand what's going on? Because what you're trying to do is reduce the rate of change, not the total. The total number is important because it goes into the calculation. So releasing numbers, in my view, in Littleton only becomes significant when it becomes significant in terms of being able to understand what the rate of change is. And that should be in the hands of professional epidemiologists and not the general public. That's my view.
I'd like to make a motion, Louise, if that's all right.
Louise, we have one more comment in the field. I don't know if you want to still.
Go ahead. You can read it or let them comment. I don't know if it's.
Matt, did you want to state your comment or would you like me to read it?
My comment was simply, I don't agree at all that only epidemiologists should have a set of numbers. I can compute a derivative of a line as well as anyone else. Whether or not people are, rational enough to react to that isn't necessarily your or my call. And I don't think that it's valid that the Board of Health only should have a set of numbers that would allow them to have very valuable information about the progress of this pandemic.
Okay.
In the chat, there are several people that are commenting, and it's basically me too, and I agree, just so that you're aware.
Thank you.
I think we need to discuss this more as a board too, a little bit longer.
I'd like to make a
Okay.
motion if that's all right with you, Louise, if you'll accept it.
Sure, Kevin, go ahead.
I'd like to make a motion to publish the data on a daily basis in regards to the number of confirmed cases, presumptive cases, and folks that are, told to be quarantined just because they may have had contact, and as well as do some sort of data analysis on the rate of change, so we can just keep an eye, locally on the curve.
Okay. Is there a second for that motion?
Should I get Gino on the phone too?
No, he's, if he hasn't been able to, he might have technical difficulties.
I think can anybody hear me?
Yes.
I think we need to discuss this a little bit more and find out who's going to do all that you were mentioning, Kevin, about analytical. Who's going to do that? Is that something that Jim is going to do, or Neshoba Board of Health? Obviously,
Gino's on the phone too.
we don't have anybody on our board that will do that. I
Run the
wanna make
data?
sure- Yep. I also want to make sure that it's anonymous and private.
Yes,
But
absolutely.
I also think that I think it two ways. My 24-year-old, it would scare him, but other people will say, we've only got one case. It's a false sense of security. So, but I think we need more discussion on it, more thought on it. And people can go to Mass Public Health and look at the change in rate of our county.
Okay, so it sounds like we don't have a second on Kevin's motion, so it doesn't pass. And we will continue discussion on it. But I think we should continue it next time because I think we've talked enough about this issue. So let's move on. The next question on Mike Zeldin's list of questions were about the local food stores, and which Jim Gareffi has already spoken about. Is there anything else that you wanted to talk about, Mike? Or did Jim answer all your questions?
This is Mike. It's reconnaissance reveals that during the senior hour of shopping at the local market basket, this is not on the market basket, this is on our senior citizens. They seem to have a greater difficulty than the general public sometimes in complying with the distance issue. So I'm glad to hear that Jim is on it and that Market Basket is looking after it. And I don't know if it's appropriate or not, but I'd like to make sure that Market Basket hears from this board that we greatly appreciate their efforts as a member of our community. I think we want to make it clear to them that we're aware and that we acknowledge their assistance.
Let's not forget Donlands.
I was.
That's fine. I mean, I just explored Market Basket because of the crowd scene, and they have other people from other towns coming in.
Okay, so I was going to say the same thing, Lisa, that let's not forget about Donlands. And Lisa, did you go there, or someone was just there? Was it you, Lisa?
I went there as a private citizen buying chicken. Yeah.
But you saw the tape on the floor. You saw them.
There was tape on the floor. It's not as big of a projection as Market Basket had on Saturday when we went. They didn't have the managers, guiding people to different cash registers, but they did seem to have every alternating cash register with a line. Cashier was wearing gloves and a mask. So.
Okay. And I know that they're also going to start up their delivery program again, or their online. You'll have to go on their website. I didn't get a chance to call the manager at Donlands today or this week, but they had it before and then they stopped it and they're ramping it up again. But I don't have a date. I apologize. I don't have a date of when it's going to start. So that might be useful to a lot of people. And our last question from Mike was, how useful for actionable planning would be sharing of information with nearby towns? Jim, can you speak to that?
I mean, we're on conference calls with the Department of Public Health, so we're kind of getting a sense of what other towns are doing. I'm not sure, are you looking to share their number counts or actions that they're taking in their stores or other businesses? I guess maybe I just need a little bit more explanation of the question.
Well, since this is Mike, I thought it was sort of apparent that other towns are looking at the same kind of situation, but each town is slightly different, and you can never tell. There might be a lesson or more than one or two lessons to learn from how they responded to particular situations. And I have no idea, for example, how Acton, which is larger both geographically and population-wise, or Groton or Air, I wouldn't know. You would know about what they're looking at, how they're responding, what concerns them, just so that we're not surprised consistently by the unexpected.
We are every day, because the questions that are coming out it's something you hadn't thought about. So we're getting questions, a lot of questions now about businesses and essential businesses and whether they should be opened or not. We're getting questions about, geez, I had an employee who test positive in the building. What is it that I need to do? Or do I need to send everybody home and quarantine them? So as we're doing that, we're looking at the Department of Public Health's guidance in those regards. As far as whether you're essential business or not, it's a pretty long list and sometimes requires a little bit of an interpretation. As far as things like cleaning and that, we tried to have the conversation with them about, why there was a situation and what they think they need to do to clean up. So we are handling new questions every day based on information being pushed by the state.
Great. Thanks a lot.
Okay, that is the end of the questions from Mike. Mike, thanks for all your research and effort in that. And I guess is Gino on the phone here, Janet? or Judy?
Can I have 2 minutes?
Yes, Gino, you certainly can. 2
Okay.
minutes.
Okay. Some people, actually, couple people came on my house and outside and they were parking the car on the other side. I thought they probably going to see the neighbor. As soon as I went out to go to the post office, they approached me and they said, Gino, I know you're in the Board of Health. My husband needs a mask. Can you get me some? I said, well, I don't actually have. And I find out that I only have one because in construction, we paint and so forth. But anyway, she said, can you help me? I said, why? Because my husband cannot breathe. So I went in several different, all the way to Air. I was going to go all the way to Leominster to Home Depot. Instead of going there, and I called up and I asked them if they have any masks. They say no. Okay, so what happened is I went to the police station, and on my way to the police station, I said, well, I'm right here at the fire department, and I go to see if the fire department, if they have anything extra. For some people, they need masks because they have a respiratory problem. And the chief, the assistant chief, was kind to me. He said, Gino, we don't have it, but there is somebody that will be able to help you. So they gave me the telephone number. I got in touch with her, and actually she's a seamstress, and she was very kind. After she heard my story that I was supposed to bring some masks to the people that really need it, she made masks from what do you call it? Not paper, from cloth, so they can be washed and reused. So I went there, pick them up, and I deliver it. Actually, who I deliver it to is David. His name is, and without giving you any other name, but is Millie McGovern brother, and I delivered it. The mask. They were very happy. The question is why we don't have any supply for the Board of Health, because they come to us and ask for help. That's my question. Why we don't have extra masks? Why can we order it just for the Board of Health? In the event that we go in a town and people they know who we are, they will ask us, "Can you help us?" That's my question.
Jim Gareffi, would you mind answering that, please?
Sure. So, we're facing the same thing here. As you try to order masks, they're not available or they're back ordered. I think if you talk to Scott, same thing. Because there's so few masks out there and because they're being allocated for police and fire and EMS and for hospitals and healthcare workers, there's a problem for the rest of us getting those masks.
I understand that. I understand that from the beginning. The question is, people say, why can we help them? And I tell them the best thing to do, stay home and wash your hands. Every time you touch something, wash your hands. Don't touch your face. We're trying to engage to be in very isolated area. But sometimes people need to go out for different reasons.
Understand. I think that message is out there that, people should be doing that self-distancing, making sure they're washing their hands and the right cough and sneeze etiquette. You're right. They do have to go out at some point in time. Whether that senior time in the morning is the right time for them to go out shopping, based on talking to Market Basket, it sounds like maybe if you come the hour after that, you might actually encounter a store that has less people in it.
I agree with you. I happened to go to Market Basket, and then a friend of mine, a policeman, says, Gino, where are you going? I said, I'm going to Market Basket. I think it's too many people. Don't go there, even though I had a mask and my gloves. So I went to Donald, and I went shopping because I need, like everybody else, to eat once in a while.
Yep.
So that's what I did. And I listened. I listened to my friend policeman. He was very kind, and what I mean, and I told him to be careful and be safe.
Excellent, Gino. Okay, so we finished all Mike's questions, and the next thing is, do any members have any questions? Members of the board? Questions for Jim or just questions in general?
I have a couple questions.
Is that you, Kevin?
Yeah.
Okay. Get 2 minutes, okay?
All right, good. Jim, I know that we touched on it a little bit, and with Mike's comments, just trying to find that that tipping point on the curve locally. We know you have access to the data. I think we need to come up with a tipping point where, this curve historically is going to look like this. I don't know if you've seen the chart. Where is it? I'm just going to put a hyperlink in the chat, if that's all right. Just, based on, if you actually go through and select Massachusetts, it's kind of like a crystal ball that says what's going to happen, and the peak's on April 15th, and this is how many beds we have, this is how many beds we lack, and just to give us, I think we need to take all this data and the science really seriously and focus on it and back out a plan from there, what we're going to need and when we're going to need it, and start the process of sourcing things locally through Mr. McCurdy and the volunteer corps and any other residents that might be of assistance to do so. I'm not sure if you've had a chance to, I don't know if you've seen this or not. There's an excellent article in the New York Times. I'm just going to put this in the chat as well. And Janet, if you could make sure this chat's available to everybody after the meeting, that'd be awesome. So that's an article from the New York Times, which basically says how Wuhan got through this thing. And, harsh actions had to be taken, eventually once they finally figured it out. So I can get you guys PDFs of these too, if it's easier. But I just think we need to act locally and not wait for an order to come down from, the state or the feds on it. The Board of Health here in Littleton is, has the capability to do these things and put plans in action. And I just don't want to see us miss an opportunity to make a difference. I feel like we could be in a position where Littleton is the first community in Massachusetts COVID free. And I think that the sooner we act on this, the better. Every day we wait is a lost opportunity to protect the public health of our citizens. That's all.
Okay, so Fire Chief Scott Wazinski has just been able to join our Zoom meeting, so we'll get an update from him.
Good afternoon. Sorry about being late. We've been a little busy this afternoon.
No worries. Yeah.
I apologize not seeing the rest of the meeting and being aware of the discussions. I did reach out to MEMA. I know you guys are having the discussion about publishing numbers in our community, and reached out as to why we don't in Massachusetts and why New Hampshire does. The reason it actually comes from DPH. DPH prohibits the local publishing of numbers. It's part of their bylaw as that they only publish per county. Reason being that for the amount of people that actually monitor the incidents that go on, and people could figure out exactly where these addresses are and who is the probable, who they are probably linked to. So it actually comes from DPH, and I was assured as of last night that that would never happen in the state of Massachusetts. I know you, Kevin, you talk of not having any cases in the town of Littleton. I can tell you that, everybody, we are just beginning. We are just warming up in town. We are dealing with an issue within the medical facility that is in town. We have many people working on this right now, and it is contained to that facility. There is no risk of it spreading outside of that facility. We're doing everything we can to ensure containment and treatment and testing within that facility. Townwide, I have been notified of those locations, and those addresses are put into our dispatch center. And if we are called to those locations, then we are notified for our safety. That is the extent of the addresses that would be put out. As far as the other facilities in town, mainly like Market Basket, as of today or yesterday, as of today, they are limiting the number of customers that are allowed in the store. It's starting at 6 a.m. tomorrow morning. We are in contact with them on a daily basis. We understand that members of the board are still contacting them on a regular basis. And you know, their guidelines, they're meeting all of the guidelines. They are essential to the town, to the support. They're going to remain opened. They do not have the ability to go to curbside pickup. So by them limiting their ability, and they're also attempting to get PPE for their own staff inside that facility, they're doing the best that they can. And they would really appreciate cooperation, especially from the Board of Health. They have been feeling a very disturbing amount of pressure from individuals, and they are going to file a complaint if it continues. Sorry.
Okay. Thank you for that update. Is there anyone have questions for Matt?
Matt's here too. I'll back up.
Okay.
Sounds like there are no questions for Matt. Do any members have any other questions?
Madam Chair, could I make a comment?
Sure, Mike, go ahead.
It sounds like members of, I'm not talking about the general public, but from the board, apparently telephone calls or something are going out from members of the board or a member of the board, I can't tell, don't care, who represent themselves as members of the board. I'd like to ask the chair a pathway to advise and ask members of the board not to make phone calls and represent the fact that they're members of the Board of Health, unless those phone calls originate with you, as prompted by, you know, significant events or significant reasons to do so. And that also the request is when they don't identify themselves as members of the Board of Health, they should refrain from calling establishments such as the Board of, such as Market Basket. I'd like to have the Board of Health to basically stick to what it's supposed to be doing as a disciplined group. Thanks.
Thank you, Mike, and I agree. I want everyone to refrain. If you need to call a store, call me, let me know, and I will call them. I would like all interaction to come through me, one source rather than a splintered voice is better. So any questions or comments can be brought to my attention, and I will contact the source. Please don't contact anyone on your own. Even, the fire, the police chief, they have so much on their hands. Every time you call and contact them, that takes away from the added duties that they have. So let's all be cognizant of that fact. Okay, is there any other comments or questions from the board?
Mike, again, I'd like to, since both the chief of police and Scott are here, are you satisfied yet that your group has sufficient protective equipment, and especially the PDs?
It's a work in progress. We have PPE. It depends on the volume that we're currently dealing with. We are, as we need additional, we're reaching out to the National Guard and MEMA, and they've been very good to us as far as supplying us with additional equipment as needed.
Thanks, Scott. Appreciate it.
I do want to say, while we have you here, Scott, that you and as well as the police, appreciate everything that you're doing, and we pray for you as you have all these added concerns on that you're going through. So we wish
Thank
you
you.
well.
Thank you.
Okay, so I guess we can open it up to the public questions. Are there any new questions, Janet or Judy?
So hi, Louise. There was a comment in here from Marianne that says Masks for Massachusetts on Facebook and our local Nextdoor group are making masks and perhaps could be approached for masks by the Board of Health to help distribute. Then it says, has the state been asked? Jen Kane wrote, while the DPH bylaws state that they will not report public data by town, that does not prohibit towns from publishing that data like Acton, Westford, Billerica, Natick, Arlington, etc., found by a quick Google check. Christine asked, can the Board of Health call these establishments daily and share their information with the public instead of people calling them on their own? Then there was a comment from Marianne says, some conservation areas are too full and people aren't distancing. What can be done? And the last question was, can anyone expand upon the situation at the nursing home without violating privacy? So I guess there was a couple things in there that might be addressed, which is, was there anything that can be done about the conservation lands and the trails in town that people aren't practicing social distancing while they're out walking the trails? And then the
I would say to that, if you go to conservation land and it looks full, turn around and go to another one. We have a lot in town. And if you can't find one, you can walk on the streets. Everybody's antsy and looking for a way out. So it's not like we're gonna limit access to them. But I don't know.
Do you need me to repeat any of them?
So I think there was one, can the Board of Health call these establishments daily and share their information with the public? I'm not sure what that means. That's from Christine Nordhaus. Are you talking about their hours of operation? Not really sure what you want from that.
Hi, Christine Nordhaus, Star Hill. It seems like hours of, certainly at Donnellan's, hours for seniors only, and that sort of thing is like a constantly evolving, changing thing. Today at Idlewild, for instance, they were only letting in 30 people at a time, a line outside with 6 feet between people and so on. These changes are evolving rapidly around town, and we can't always and shouldn't all be out there trying to sort of see what's going on. So if members of the board are contacting local grocery stores and other essential businesses and finding that they're changing their hours or protocols or procedures, is there a place somewhere on the Board of Health website or whatever where you could be sharing this information with the public as it evolves and changes?
Yeah. Thank you, Christine. We are working on putting a spreadsheet together to put on the website, so we will have that up as soon as we can. I'll make note of that. Okay, after Christine's comment, is there anything else that you see that looks like? Scott, someone's asking to expand on the situation in town, but I think you have fully explained it.
I really can't go into detail at that facility. The baseline is we are dealing with an influx of patients. And we're doing the best we can. We have several agencies are involved, and we're trying to just do the best we can at keeping everybody safe, healthy, and contained.
Okay. Okay. Maybe we should go to Alex McCurdy's presentation for the Littleton Volunteer Corps. Thank you, Matt. Scott, I'm sorry. Do you want to stay on, Scott and Jim, or for Alex's? Okay. Okay, Alex McCurdy, you want to present for the Littleton Volunteer Corps.
Okay, thank you, everybody. There have been several questions from Kevin in particular about our process for getting people on the volunteer corps. But before I get to that, I'd just like to give you a little update from the information that avenue that I have, and that's through the Medical Reserve Corps. And there have been a number of requests through the Medical Reserve Corps for assistance in various places throughout the state. We have opted not to offer our personnel for that. And there's a lot of reasons to consider that, safety and distance and a whole bunch of other reasons to go through that. But there are steady requests coming out through the Medical Reserve Corps as a state entity for assistance at places that you might have seen in the news. I'll put it that way. So I'm monitoring all of that. I have in answer to the questions, I have a very short presentation, but with the chair's tolerance, it's probably more than 2 minutes. So,
That's fine.
So Janet, I'm going to share my screen at this point, if I may.
Yes, you may.
All right. I should be on there now, right?
We see all sorts of things.
Well, you should see a picture of which I have several of my volunteers. Is that what you're looking at now?
We see your entire screen, so we see all the other applications too. So if you want to maximize that window, then it will.
Well, when I went over this with Kirby to do it with Zoom, I can't maximize the PowerPoint. So what you should have front and center is my PowerPoint presentation.
Yes, we just also see your email and things as well.
Yeah. Okay. So I will get into this very briefly, if I can get it to work. So essentially, we are a broad-based organization that fits whatever need exists. We're all volunteers. We work under the functions of the Medical Reserve Corps and the Community Emergency Response Team. So what that means is that we are in a unique position that we are appointed by two authorities. The Emergency Management Director appoints all members of CERT. The Board of Health appoints all members of the Medical Reserve Corps. And that's why when we do these appointments, the chief does his at the same time as the Board of Health does theirs, and that creates a unity in our organization. We don't get fragmented. We don't have one side or another that we belong to. So we can work in planning or just about anything else that people may need from us. And in this particular case, we are not terribly active, but we are prepared for whatever, I put down here, surge resource that we might want to be. And that comes from requests from other people. We don't have any role until such a request comes. And if somebody has a question, feel free to, ask. I can't see who's putting up their hand as easily because I switched it to the other screen, but. So one question was asked about how to join. Well, joining process is very simple, and at the last meeting, Christine expressed an interest in joining, and she's filed all the paperwork that's necessary. We just have to wait for the state to do a query check, and it's that simple. So you made the appointment today, and that's contingent on completing that paperwork, and that's a requirement by law. So people can go to our website, and we have a contact us section, and it could be just as simple as putting in your name and your email, and I would like to join. And then most likely I will follow up very shortly thereafter and initiate the conversation of how to join. I was also asked about membership requirements. To belong, there's a couple of things that have to happen. You have to submit an application. You have to agree to a query background check. Once you're appointed, there's some state mandated public official ethics training that's required of every single public service person in the Commonwealth of Massachusetts. And you have to have an ability to participate in regular trainings, and we don't have too many activations, but when they come along, be willing to participate in that to the extent you can. We meet on the second and third Wednesday evenings. Those are where the fire chief has designated the training facility for us to meet. And all our meetings are scheduled around that unless there's a special circumstance. And that runs around 12 times a year that we meet. So my screen just went dark here, so hang on for a second. Okay. So required after you join, you have to have first aid and CPR. You have to have basic incident command systems, which is an online program to get that out of the way through FEMA. And you have to get onto the method that we use for alerting people, which is the IM responding system. And that's hosted by the fire department and the fire chief. What the training opportunities will be for members when they get on. This is why when we will accept anybody. We would love to have people that have a medical background or an emergency services background, or anything that would help in the mitigation of a disaster, so to speak. But a willingness to volunteer is really the most important thing, and we will train people from that point on. So they'll be trained on things like stop the bleed. One of our roles is an emergency dispensing site, and another is shelter operations. We work the road race and other events to help with traffic mitigation. We are working with the fire chief to do fireground rehab support operations. We have to learn how to run radios. We've had fire extinguisher training. We've gone quite a bit into the FEMA incident command systems, and we have training modules relative to the CERT, Community Emergency Response Team programs. And that's what we do with those 12 meetings that we have every year. So I don't want to take a lot more time with all that, but it's really that simple. Just go onto our website, ask if you want to join. We'll talk to you a little bit. We'll get the application going, and we're happy to have you. We currently have about 16 active members. In this given situation, there's a lot of considerations that have to happen. Not all members would be available to respond depending on the nature of the request. And of course, some of them are at home taking care of kids and doing the homeschooling and all of that stuff too. So we're, at our high water mark at any given training, we're about 16 strong, and we go from there. So other than that, unless somebody has any questions, I came pretty close to the 2 minutes.
Excellent presentation. Thanks, Alex. Does anyone have questions for Alex?
All right,
guess
did you take your screen back from me?
Yes, I did.
Okay.
I think someone might have a question. I thought I heard someone
Yeah,
start
that was
talking.
me. I don't know if you can hear me. So Alex, who mobilizes you guys? Is that through the police or is that through the state?
I'm sorry, can you identify yourself, please?
Lisa, it's Lisa.
Oh, Lisa, I'm sorry, I'm not seeing you.
All right, so the
Sorry.
mobilization is done in a couple of ways. We work extremely closely with the fire chief. So nothing we do happens without him and I having a conversation about it first. There's a lot of reasons for that. That's one of the things that happens. So the fire chief, the police chief, can ask for help at any point in time. And that's usually given that if it's something we can help with, we will help. Any other organization can ask for help, and it's vetted through me and the fire chief as well. The other way that requests come in is through the Medical Reserve Corps. And that usually comes through the region. And that's where I've been fielding all the information about the requests that are made across the state. One of the abilities of Medical Reserve Corps is they can respond outside of their own jurisdiction. And there's a credentialing methodology that occurs when that happens. And so if they request help, it's probably a blast of a number of communities. They ask for help. They look for specific expertise or whatever's necessary to cover the situation. I will assess the situation at that point, and then there'll be a conversation between the fire chief and myself before we commit to anything. And by the way, in situations like this, we will poll individual members offline to see if they're willing to commit to something. So for instance, one of the things that we had was the Board of Health was trying to integrate in some volunteers, and they were looking for RNs, and we provided them with 2 RNs that were willing to participate in that. I don't know where that's ultimately going to go because things are changing fast, but that's the kind of thing that we're ready to do.
I guess I have another question too, Alex. Have you guys been mobilized at all or been asked to be ready to go by Scott at all, or?
No, there have been the requests through the Medical Reserve Corps, of which we did not mobilize.
Mm-hmm.
And this is the nature of what we do. We hope that we never have to be mobilized, but we train for a lot of different things. So we have mock mobilizations and stuff like that we do. The last time we were mobilized was, I believe, the ice storm from way back when we ran the shelter. We ran a shelter. A couple other times we began to run a shelter, and we've assisted Neshoba Associated Boards of Health with flu clinics and stuff like that.
Okay, thank you.
Any other questions for Alex? Okay, thank you very much, Alex, for your presentation. So would someone like to make a motion to adjourn? Oh, wait, before we do that, we have to talk about setting up our next meeting. I would like to do it on April 8th at 2 o'clock, which is Wednesday, April 8th. Is that good with, we'll just do a roll call to see if it's good for everyone. Lisa, is that good for you? Lisa, you're muted.
No, I'm not, but yeah, that's fine.
Okay. Gino?
Gino's gone.
Okay. Kevin, is that good for you?
Yes.
And Mike, is that good for you?
Doesn't look that way. I'll just say tentatively yes. I'll see what I can do about shifting.
Scott?
Yeah.
Is that good for you?
I think he's gone.
Scott's gone. How about Jim Gareffi?
He's
Jim, is
muted.
that good? Jim's muted.
I'm sorry. Did you say April the 8th?
Yes, April 8th at 2 o'clock.
That's a
When-
Friday, correct?
It should be a Wednesday, a week from today. Today's April 1st.
Yeah, it's a Wednesday.
Yep, sorry. Yeah, that's, yeah, I can make the 8th. I've just shifted something around.
Okay, I appreciate it, Mike. Okay. Did we hear from Jim Gareffi yet, or
The 8th?
April 8th at 2 o'clock, which is Wednesday, next Wednesday at 2 o'clock?
Oops, I'm wrong calendar day here. So, yeah, I should be able to do that.
Great, thank you, Jim. And Janet, could you maybe get in touch with Scott about the next meeting, please?
Yes, I will.
Okay, would anyone like to make a motion to adjourn?
I'll make a motion to adjourn.
Second?
Second?
Okay, so we'll go through a roll call. So Gino's not on anymore. Kevin?
Aye.
Yes, we don't have to, I'm sorry. So we've got a first by Lisa and a second by Mike. So we are adjourned. Thanks, everyone, for coming. See you next week.